You're welcome to Let's Talk.
We need to sit down and talk. We need to sit down and talk. How Nigeria corruption, how we're going to do our job.
If one can stand up and say no to corruption, we're going to do our job because we're cleaning the system. You are not just doing good for yourself or for the nation alone, you also do good for the future. The Sovereign National Conference, how do we want to achieve that in our present system? We need to sit down and iron out how Nigeria should be governed.
Okay, well, a beautiful day to you and yours again. This is Let's Talk on Love World Plus. Thank you for joining us again today. My name is Zoe Okafor, and in today's edition, we're going to be taking a look at trauma care and blood donation, or voluntary blood donation. Now, using Nigeria as a case study, it has been noted that 80% of trauma incidents, such as road accidents and household injuries, result in deaths due to poor emergency response systems and other basic first aid techniques. Now, another prominent challenge has been the non-availability of blood for transfusion to victims of traumatic blood loss. Now, this is why Trauma Care International Foundation has risen to the challenge of driving blood donation to prevent avoidable death situations. So these are some of the things that we are going to be looking at in today's edition of Let's Talk. And to help me talk about this, I am joined this morning by Dr. Amaka Adekoya. She is of the Trauma Care International Foundation. You're welcome to Let's Talk.
Good morning.
Thank you very much. Okay, so Trauma Care Foundation, and voluntary blood donation. Now, before we really get into it, I want us to, for you to shed some light or give us a little backgrounding as to what Trauma Care International is really all about, its activities, so that will help us better understand what we're talking about.
Trauma Care International Foundation is actually a registered NGO, and our mandate is to improve the state of emergency response, trauma care and emergency response services in Nigeria. This we do through health education, community-based programs, and advocacy. So it's on that premise that we have devised different specific programs. We have the Child Safety Awareness Campaign, through which we are going to the schools to train children on the right way to respond to emergencies. We have the Campaign for Improved Trauma and Emergency Response. We call it CITA for short. So this program takes us to organized communities like companies, garages, motor parks, where we're training the major road users. Most times this comprises the drivers, the conductors, on the right way to respond when there are emergencies. Things like basic first aid, CPR, what can they do before help arrives to make sure that people stay alive. One of our initiatives is the Voluntary Blood Donation Initiative, which we're talking about today, because like you said, a lot of people die because blood is not available when they have cases of traumatic blood loss. So we want to create a network of unpaid, voluntary, safe blood donors who will come out regularly and donate blood so that we have blood available in our blood banks, and then the issue of there was no blood in the